Welcome to all participants. I would like to welcome you to this webinar on tackling disadvantage in early childhood, key findings and challenges as part of the first year's first priority campaign. As president of Eurochild, I am delighted to be introducing this important event, which is being organized by Eurochild and ISSA, the International Step-by-Step Association. I would like to convey our appreciation to all our speakers and guests for being with us today. Before I introduce the campaign, the speakers, and the scope of today's event, there are some quick housekeeping points which I need to inform you about. Firstly, please note that this event is being recorded and will be available on the first year's first priority website at the end of this webinar. We'll have an opportunity for questions, so please put your questions in the Q&A function, and we'll try to address as many of your questions as possible. Speakers, please mute your microphones if you're not speaking to avoid background noise. For those using social media, the hashtag for the event is #first year's first priority. And lastly, as we go along, my colleagues will also include some information on the campaign and the chat function. Many of you would know that in 2020, Eurochild, together with ISSA, the Roma Education Fund, and the European Public Health Alliance, launched a campaign to highlight the need for more attention to early childhood development and to ensure that all children can have the best start in life. With the campaign, first year's first priority, a first start for every child, we want to increase the understanding of and support for early childhood development in government policymaking and public investment, as well as among families, communities, and the general public, so that early childhood development becomes a public policy priority. There is overwhelming evidence of the importance of a child's healthy development in the first years of life, showing how children's experiences in early childhood can shape lifelong outcomes and opportunities. Children's development depends largely on how parents and caregivers interact with them and respond to their needs. Women's access to quality maternal, newborn, and child health care services are a key prerequisite for children's survival and healthy development. Many women in Europe, however, face barriers to accessing these services, especially those with a Roma background, those with irregular migration status, young mothers and women living in poverty. Ensuring universal access to these services is essential. So young children's well-being is not just a private matter. Governments have a critical role in supporting parents, families, and caregivers, and in creating an ecosystem of policies and services that meet the needs of young children and their families. This is why the campaign has a particular focus on children in their first 1,000 days. Child poverty and social exclusion affect children from their beginnings. So it is essential to address these in early childhood, to tackle discrimination and exclusion, and to ensure that all children have access to quality services and support. This is why we want to pay special attention to the most marginalized children. These are the children living in extreme poverty, migrant and refugee children, including those who are undocumented, Roma and traveler children, children with disabilities, and children at risk of entering or in alternative care. The COVID pandemic has both exposed and exacerbated existing social inequalities, and the effects on young children and their families have been severe, demonstrating the need for a recovery that builds stronger, long-term, resilient early childhood systems and sustainable support for families and caregivers. Public investment in early childhood is one of the most visionary and effective policy measures that governments can take. Investing in nurturing care and quality early years services is essential for tackling child poverty, inequality, and social exclusion. The campaign supports the advocacy of national partners in 9 countries across Europe, in Bulgaria, Romania, Spain, Ireland, France, Finland, Portugal, Hungary, and Serbia. They have formed national coalitions to increase support for early childhood development in their country. The European Child Guarantee and the EU Strategy on the Rights of the Child are 2 groundbreaking initiatives that can make a real difference to the lives of children across the European Union. The European Child Guarantee and the EU Strategy on the Rights of the Child are huge opportunities to catalyze action on early childhood at the national level. The Child Guarantee comes at a crucial time. In 2020, across the EU, 24.2% of children were at risk of poverty or social exclusion, compared to an average of 21.9% for the total population. The full extent of the impacts from COVID-19 pandemic on children's lives is yet to be understood. A priority focus on children in vulnerable situations and who are experiencing discrimination and exclusion is essential to realize children's rights and uphold states' commitments under the UN Convention on the Rights of the Child. The EU Strategy on the Rights of the Child rightly recognizes that every child has the right to an adequate standard of living and to equal opportunities from their earliest years. It is crucial that the implementation of the Child Guarantee across EU member states pays particular attention to children in need who are under 3 years of age. The national action plans for the implementation of the Child Guarantee offer an opportunity to develop integrated, cross-sector approaches to ensure access to quality services for all young children and to involve families, caregivers, civil society organizations, and children themselves in this process. It is important that policies are coordinated and that professionals in different sectors collaborate with one another. Integrated services addressing the multiple factors directly impacting children's development are the most effective in improving outcomes for children and families. However, the coordinated approach to early childhood public policies, funding, and services is not yet mainstreamed in Europe. The dominant silo working approach leads to gaps and or overlaps in addressing the needs of children and families. Today, we will hear from our colleagues on some key findings from their analysis of early childhood indicators across policy areas. The findings highlight the need for better data and greater investment in public policies for early childhood development. We will hear from Issa on the cross-country findings and from 4 of our partners on some of the key issues in the country. We'll also hear from the European Commission on the important role of the Child Guarantee and the EU Strategy of the Rights of the Child in catalyzing much needed support for early childhood in EU member states. I am therefore delighted to welcome our first speaker, Minister Adrien Taquet, Secretary of State for Childhood and Families in France. France has recognized the fundamental importance of early childhood and the first 1,000 days as a priority, and the need to create a comprehensive policy approach to those first 1,000 days, centered around the child. This is also in response to the needs of parents and the difficulties they often face with fragmented information and lack of support. As part of this comprehensive policy approach, the French government launched an initiative to provide more information and support to parents with young children. Minister Taquet was elected to the French National Assembly in June 2017, representing the Department of the Haute-Seine. In 2019, he became Secretary of State for Child Protection at the French Ministry for Solidarity and Health, and was nominated in July 2020 as Secretary of State for Childhood and Families. He's in charge of child protection, parenting support, and the fight against all types of violence against children. It is truly a pleasure to now invite Minister Taquet to take the floor, or rather the screen. Specifically.
Thank you very much. I hope everything's can hear me well. Is it the case? Yeah. Well, it's a shared pleasure to be here. Thank you very much. First of all, dear Marie-Louise, dear organizing team, thank you very, very much for your invitation. Thank you for the work that has been done and is going to continue for the coming weeks and months. And thank you for giving me the opportunity to participating in this event. And thank you to Eurochild for this action, and especially for this first year's first priority campaign. I have always tried, I believe, I hope, from where I am, to value as much as possible the work of NGOs, because much of what we know, and hence much of what we do, actually, comes from their long and hard work. And this discussion this morning proves it once again, I believe. I would therefore also like to thank our partners and friends at Ensemble pour l'éducation de la petite enfance. Thank you very much for your work and for your contribution to this campaign that led to a cross-country analysis and a specific focus on France. I found both these documents very interesting. I read them carefully. In France, you know, we don't have this culture of international benchmarking. It's not in our culture. It's a pity, and we have to improve it. So every time we can have comparison of that kind, it's very, very inspiring, and that's the case. So thank you very much for that. I think these documents you've been elaborating shed an honest, detailed, precise light on the challenges that European countries, and among them France, face when it comes to their early childhood policies. This, of course, gives me the opportunity, if you agree, to react to what is in those documents, but even before that, to recap maybe a little on everything, maybe not everything, but on some of the main actions the French government has done these last few years to try to improve our action for early childhood. So this is, you've been mentioning it, Marie-Louise, that this is of course what we are doing around the first 1,000 days of life of a child. We know now, thanks to rigorous scientific works, that this period is crucial for a child's development. It is in a world where it all begins. A time of unlimited potential, but also a time where, unfortunately, the first inequalities between children can rise in terms of social, cognitive development on every ground. And such inequalities that expose some and not others to specific risks have a deep impact on children's life, but also on the life of the adults they will become. And they also often repeat themselves from generation to generation. And this vicious cycle, in some ways, has to be broken. In France, I think you need 5 or 6 generations to get out of poverty within the family. So this is why we need to act, of course. We know, thanks notably to the Nobel Prize, James Heckman, among others, that the sooner you act, the easier it will be to prevent difficulties from arising or worsening. And James Heckman wrote, probably know the quote, the highest rate of return in early childhood development comes from investing as early as possible. It's what we call social investment, and I truly believe in it. And it is a call to action we must answer. Beyond children themselves, let me say that the more you support parents during those very early times, the more you will allow them to gain confidence and well-being and to be there for their kids. That is also why we insist on the importance of parent support. We have taken many steps to structure this relatively new field by identifying, for instance, a unique phone number to reach when you have a question on your child, or by funding specific actions that directly benefit parents all across our country. This of course has to start from the very beginning, and that is why we have a few years ago made it mandatory for all pregnant mothers to go through a prenatal discussion with a doctor, so that they can discuss every important aspect of pregnancy, and not only concerning the health issue or health in terms of in the sense of the World Health Organization, in a very holistic approach. In just a few weeks, we will also make it mandatory for all mothers to go through a postnatal discussion with a doctor to make sure that everything is going well for the baby in terms of health, but also for the mother and for the parents. And we want to tackle what is still a taboo in France, but who affects probably 20% of the French women, which is postpartum depression. You know, suicide is the first cause of mortality in France for women who just got a child. So it's really a political battle. It's a health issue. It's a health public policy issue, but it's also a political issue because it relates, of course, also to gender equality. So this is very important to our eyes. And so on those matters, we are careful to take into consideration from the very first step, the opinion of parents themselves. All this first 1,000 days policy has been built with scientific people. There was a commission with scientists of all professions. It was chaired by Boris Cyrulnik, famous neuropsychiatric in France. But also, we discussed a lot with all NGOs and with the parents themselves to be as close as possible to their needs. We want to listen to what the parents have to say about their personal experience, know about the difficulties they can meet. And that's especially true for those parents or children with specific needs. And for instance, for children with disabilities. We are trying to design specific policies for those specific needs, while maintaining a universal approach that guarantees that all parents will benefit from an effective support. So this first 1,000 days of life for children is both universal for every parent and every children. That's very French. We are very attached to that and we want to keep it. But it's mixed also with a specific approach for specific needs. And in addition, we are doing a lot to improve the quality of early childhood care. Among other things, we have shared with all professionals a charter of quality when it comes to welcoming young children in their structure. We have done so to set strict quality notions, and beyond that, to show that welcoming young children does not only mean keeping an eye on them, be careful about their safety. Of course, it is important, but it also means encouraging playful, recreational activities, transmitting an appetite for learning, for reading, from the very first age. You probably sense that much of what I have told you directly relates partly, mostly to the content of the European Child Guarantee you were mentioning. As you know, the ECG aims at providing every European children with either free or accessible services designed to protect them from the risk of poverty or social exclusion. And many aspects of the ECG are already a reality in our country. This is something I believe we can be proud of. We are at the forefront of this general mobilization to improve children's day-to-day lives. I could have also talked about what we do in regards to free breakfast at school, which was a Scottish initiative, the very first. We've duplicated it in France, or accessible lunch in all schools. Also, what we do to secure alimony and child support for single household families, about the attention we give to children in institutional care. I will simply say that I'm very grateful to the European Commission for having made all these issues some of their priorities for the next few years. And I hope we will all together have the opportunity to keep working on this. And I'm also aware that we still, of course, have progress to make here in our country with that regard. We are talking about the national plans that have to be designed and elaborated by each country. They'll have to be finished, terminated, presented in a few months, and it will be under the French presidency. And therefore, in March 2022, under the French presidency, we will organize a big event in Paris around the European Child Guarantee, and it will be the occasion to discuss, confront these national plans and to enrich our vision of these issues. So we have margins of improvement in France, of course, and I count on you to help us identifying them, of course, to help us determine what the best course of action may be for the next decade, and to support our actions when they answer to the fundamental needs of the child. Your campaign has already starting doing that, I believe, and as a quick reaction before taking some questions, because I think you had some questions to ask me. I just wanted to say that what you have written on the subject of data gathering is very interesting, of course, and I share your willingness to reinforce public statistics on children and families related to policies. I know it's an issue in France. I didn't figure that it was also an issue in many other countries. I think this can be seen in the importance we have given to actual science, neuroscience, and data science. And that's what we do for the first 1,000 days policy, and it's really need to reinforce public statistics on children and families. You may know also that I have asked an independent body known as in France as the High Council on Family, Childhood and Age to work with all appropriate partners to identify precisely how much money we dedicate in France to childhood policies, because it's very divided, compartmented, and everybody's doing a little in his own field. And it is mandatory to have more visibility on this, more coherent vision of what we are doing. And for instance, to be able to distinguish between spending going to children under 3 and spending going to older children. The idea of gathering everyone around one table has also taken form recently in the Conference of Families that have organized for the first time in more than a decade. It was a month ago or so. And it is my wish, and I have taken according measures to ensure it comes true, that an open dialogue continues in the following years on the subject. And I hope to see the same thing happening, of course, at the European level. We will, of course, have a place in it. That's obvious to my eyes, and I hope that through my intervention you have sensed how much importance I give to transparency and to emulation between all of us. I welcome any opportunity to cross opinions, to challenge what we may otherwise take for granted. And I'm now happy to answer to the questions you may have to ask me. And once again, thank you very much for the work. Thank you very much for your invitation.
Thank you so much, Minister, for your inspiring words and also your sense of commitment towards this very important area of our conversation today. Well, you do have a couple of minutes, I think, before you leave us. Can we ask you a question, please?
Yes. Maybe only one, if you don't.
One question. Okay, one question. Yes. I'm aware of your busy schedule. The French government's initiative on the first 1,000 days is very welcome in Europe as a means to tackle poverty and social exclusion from the very early years. And you did mention the issue of intergenerational poverty. How can civil society support the development and implementation of the Child Guarantee Action Plan in France? How would you foresee civil society's engagement in the co-construction of the national plan?
Yeah. Well, I believe the French government will, of course, consult civil society in its preparation of the National Action Plan, which is expected, as I was mentioning, next March 2022. We will welcome and take into account as often as possible the opinion, advices, and remarks of NGOs. And I can take this opportunity to encourage you all to send us your ideas, and we will also organize plenty of work sessions. It's not designed yet, but we are working on it, and we'll be informed, of course, of how we're gonna make it to be sure that your voice is heard. I think we have a history, I hope, of working with independent organizations, notably those specialized in fight against poverty and social exclusion, and so we will continue to do so because for me, it's once again it's something obvious and to do so. And if I can just add something, it's also like to insist also on the fact that we will try to do, and I share that with not only with Commissioner Schmidt. We need also to take into account children's opinion, and we have to find design a way to take into account the opinion of the children themselves, not only the very important and bright adults we all are, of course, but also to get the children's opinion. I think that's a broad issue to take into consideration the children's voice. We're not doing it enough, generally speaking, and that's the opportunity to do it more and to do it well. So that's also very important to my eyes.
Thank you so much, Minister. And you also put our minds at rest at Eurochild, that child participation is also at the core of the way you will be consulting and, well, creating the space for participation. Really, thank you for your important contribution today, Minister, and for sparing us with that. Thank you.
It was important for me, and thank you very much. And pleasure to meet you soon and to see you soon.
Thank you.
Have a nice one. Bye.
So now I would like to introduce Mr. Alioza Rudas, Senior Program Officer of the International Step-by-Step Association, who will present some of the key findings from an analysis carried out by ISSA and the national partners of the campaign on early childhood indicators. Alioza has over a decade of experience working in the field of early childhood and coordinates the Romani Early Years Network. Alioza, the floor is yours.
Thank you very much. Let me briefly just share my screen, and a warm welcome to all of you participating today. It's a pleasure that I can present the key findings and the results of campaign's evidence on behalf of our team. And as mentioned earlier, I will actually walk you through the campaign's evidence and presenting the cross-country analysis and partially country profiles, which will be also presented later in the second part of the event around the 6 policy areas that were observed in the cross-country analysis. And if we just start, before we delve into unpacking the data, objectives and key findings and some next steps, let me first acknowledge the contribution of national coordinators and their coalitions, without whom the cross-country analysis, country profiles, and the evidence of the campaign wouldn't be possible. Therefore, with the gratitude, we thank Bulgarian team from Trust for Social Achievements, Finland team from Central Union for Child Welfare, French team from Assemblée pour l'éducation de la petite enfance, Hungarian team from Family Child Youth Association, Irish team from Children's Rights Alliance, Portuguese team from Fundación Nossa Senhora do Bom Sucesso, Romanian team from Step by Step Center for Education and Professional Development, Serbian team from Pomoć Deci, and Spanish team from Plataforma de Infancia. And moving to the next slide. So as you can see, we are spotlighting on early childhood with country profiles. trying to build evidence to advocate for coordinated policies, funding, and services around young children and their families, especially those who are most vulnerable. And as mentioned before, based on the data in 9 country profiles from each country campaign with the support of the country partners, you can find interesting findings that definitely you can read at our website, firstyearfirstpriority.eu, and just feel free and explore the very rich library of resources. So, and let's now look first at the cross-country analysis, what it is about. So the analysis in a way summarizes the situation of young children across 6 policy areas impacting their development. And it's based on data that was collected in 9 European countries. And we are also consolidating it in one cross-country analysis. But you can also find individual 9 country profiles. Actually, the cross-country analysis draws attention towards 4 key findings that I'll be presenting a little bit later, impacting early childhood development, ECD, and some priorities for policy making and investment in early childhood at European and, of course, at country level. But now I would really like to unpack a little bit this holistic view or perspective on early childhood development, which most of the time we can equate it with early childhood education and care services. So it's that in the campaign, we are looking at early childhood development holistically. So as we like to say, through 360 degrees perspectives lens. And we've been looking at 6 policy areas such as child poverty, maternal health and nutrition, child safety and security, early learning, parenting and family support, cross-coordination of policies for ECD. And under each, there are some explanations why this category. For example, like in child poverty, we refer to children who live in poverty, who don't have access, they often lack the food, sanitation, shelter, healthcare and education they need to survive and thrive. On the other hand, when it comes to the area of maternal health and nutrition, under this category, we actually refer to maternal health during the pregnancy, childbirth, and the postnatal period. And then while the child health refers to the health status of children at the prenatal, birth, and postnatal period, and so on. For example, like in early learning, so refers to actually data regarding children's access to environments that ensure stimulus and learning in both home learning environments and out of home settings. And for example, like cross-coordination of policies for ECD is in a way reflecting the idea and the concept of a holistic approach of and when investing in ECD, actually aiming at promoting responsive and effective policies and cross-sectoral policy solutions that are in a way informed by evidence. And while moving to the next slide, we are diving a little bit deeper into the data gathering. So here are the indicators. So having in mind the comprehensiveness of early childhood development, a set of indicators for each policy area was assigned, based in which data collection then in 9 countries has started. But when these indicators were assigned, so soon after we realized that there is limited data on ECD related indicators, especially regarding children under 6 years of age, and even more limited were those for children under age of 3 and their families. And this was the case for all 9 countries and across all 6 categories that we are observing in our country profiles and cross-country analysis. But definitely you can read more about the indicators and findings in the cross-country analysis, which you will find, as I mentioned before, on our website. And now let me briefly go to the key findings which are the most important part, let's say, in a way, of the evidence we are sharing today. So as you can see, we have 4 key findings and challenges. The first refers to scarcity of data on children's early years, especially children under 3, across all policy areas, and actually indicates insufficient knowledge of and attention to early childhood development. The second key finding refers to limited or non-existing disaggregated data on the lives of young children under 6, especially those under 3, who are living in poverty and social exclusion, and hinders efforts to improve public policy investment for young children facing multiple and intersecting vulnerabilities. Comprehensive and comparable data is necessary at country and European levels to inform policy making and public spending on early childhood so that all children can have the best start in life. And the third challenge is that across countries, there is a need to guarantee universal access to quality early childhood education services, especially for children under 3 and those who are most in need, alongside giving a greater support to families with young children. This, in a way, requires increased public investment in early childhood education and care and parenting services, as well as strengthening the capacity and professional development of ECD workforce so that they can be more responsive to the children's needs at their very early years. And the last one that was observed, the key challenge or finding, is that there is a need for an integrated and multi-sectoral approach to early childhood with the leadership coordination that addresses children's and families' needs in a comprehensive way, just as we are promoting in the campaign. So beside these key findings, we also want you to look at the priorities at European and country levels. So we have shared data priorities and shared policy priorities. And the analysis of priorities indicate that consistent data collection at national and European level is needed to elevate the rights of young children and to improve decision-making on policies and finances that are affecting early childhood, and as well as to track the progress of it. Therefore, we are introducing this set of priorities, highlighting potential measures to better support the data collection and monitoring within and across countries, and as well at the European level. So when it comes to shared policy priorities, with this set of shared policy priorities, we suggest some key actions and levers that governments and EU bodies should follow and or take into account when initiating or enabling the policy change. Actually, a change that impacts the status and well-being of young children and their parents, and ensures equal access, increased availability and affordability of services, programs, and as well mechanisms, and a change that in a way addresses children's and families' needs holistically. It's, in a nutshell, we could say that this is for a better tomorrow and for a safe and stable future, for a Europe where every child has a fair start and caring environment to grow and thrive and to develop his or her unique potential. And just the last slide, and then I'm finished, is so that you can follow us, use the hashtag as it was mentioned before, contact the coordinator of the campaign, Agata, or myself to learn more, and check our website, which is rich with the resources. Thank you very much.
Thank you, Aljoza. Thank you for your constructive contribution. And now it is a great pleasure to welcome Katarina Vankovic, the Director of Social Affairs, DG Employment, Social Affairs and Inclusion. Katarina is one of the architects of the European Child Guarantee, and her unit has played and continues to play a key role in championing and disseminating this important initiative. Katarina, we are eager to hear your contribution. The screen is yours, Katarina.
Thank you very much, Marie-Louise. You know that I would prefer much more if we would take the floor, share the floor, and we would be somewhere together. That would be so much better. And I believe all of us share the same thoughts and the ideas. Thank you very much for inviting us to reflect on the findings of this extremely important document, extremely important work that you are performing regarding the first years and how important they are. Also, I would like to thank Alyosha for really taking us through a very complex, I would say, matter in such a concise and clear manner. So thank you, really appreciate it. And I can tell you that I also fully share I appreciate your frank approach and your frank understanding of the shortcomings, especially on the data on early childhood. And this made me, this proves also that we were so right when we asked the member states in the European Child Guarantee recommendation to enhance the availability and the scope and relevance of comparable data, including on children in need and their access to services. This is, I believe, something that is very common to all the member states, and this is also something that you pointed out. It is also important to be really able to have this granular information about the groups that needs to be targeted, and this eventually allows the relevant authorities really to design the most effective interventions. In any case, unfortunately, we know that too many children in the EU are at risk of poverty and social exclusion. And even though this figure has been slightly decreasing, but still it is way too high. We also know that those coming from socioeconomically disadvantaged families have indeed suffered more as the result of as the consequences of the COVID-19 pandemic. And we are very much aware that we need to act to prevent this disadvantage from petrifying, actually. The European Child Guarantee, as Maria Luisa has pointed out, is, I believe, the right way forward in tackling poverty of children, but also in making sure that they really utilize and execute the equal opportunities that they should have in all member states at all levels, wherever they live, no matter of the spatial limits and no matter of the development of the region. Also, one of the most important aspects of that child guarantee recommendation is tackling is the unequal access to services, and these services are fundamental for the well-being of the children. So in accordance with your project and with your work that you have been doing for quite a number of years, first years are indeed first priority for us, because we ask for effective and free access to high quality early childhood education and care. And also we ask for the free access to education and school-based activities, for school meals and healthy nutrition, healthcare, and we ask for efficient access, effective access to adequate housing. Of course, we are not naive. We are very much aware that European Child Guarantee on itself is not enough to eradicate fully the child poverty. And it is about, unfortunately, about a quarter of children that today are in danger of poverty and social exclusion. Children are dependent on their families. Children are dependent on their carers and on the wider society for their development. And this is why the European Pillar of Social Rights Action Plan includes a number of initiatives which are aiming at improving the economic situation of low-income households. And the joint aim of those initiatives is to reduce by 2030 the number of children at risk of poverty and social exclusion by at least 5 million. And I can tell you that together with my colleague Barbara Kaufmann, we are now in the process of discussing with the member states on the targets, on setting the national targets. And one of the most important aspects that we look into is the reduction of 15 million less people in poverty by 2030, but then also we look into the number of children, and we are assessing also what is the ambition of member states in order to address this figure and this important figure. What is also very important is that there is EU funding that is available. There are those member states that must allocate a certain amount, a certain percentage for the child guarantee implementation. But what makes me happy is that we see that in the process of negotiations between with different member states, those member states who do not have this obligation because their average of children at risk of poverty and social exclusion is below the European threshold, they are allocating funds, and some of them are allocating sufficient funds, amounting almost up to 8 or 10% of the overall allocation, which is really good if we have in mind that the obligation is to have a 5% for those 11 member states. The ESF Plus is not alone. There is the European Regional Development Fund, namely for the infrastructure, and we know how important infrastructure is for those early years, how important it is to have a sufficient facilities for ECEC, but even more important to have sufficient human resources that will fill in these facilities and provide additional support for children, especially when it comes to some groups of children that do need additional assistance, like children with disabilities or children with learning difficulties, or children belonging to some other disadvantaged groups. So all of this is going to be addressed in the national plans, which are presently being prepared. The national plans, as the direct result of the recommendation, are supposed to be finalized by mid-March next year. But we did not let the member states do it alone. We help a lot. Also, the Eurochild is helping a lot in this regard. And we already had the first meeting of the national coordinators. All member states, but one, have appointed the national coordinators, and we hope this last one is going to do it as soon as possible. We had a first meeting, and at the beginning of December, we will have the second meeting. We are partnering also with all the relevant stakeholders, like, as I mentioned, yourself, but also UNICEF, who is implementing the third phase of our pilot project. And we are very happy to see their so-called deep dive part of the project, which is in-depth analysis of 7 member states in regard to the recommendation, is being finalized, and they are also going to present it in the next meeting of the national coordinators. We also plan to invite you in one of the coming meetings of the national coordinators, because you have been really extremely helpful in the process of the preparation of the recommendation, a good advocate, and I believe also the part of the success of this recommendation is also due to your great work. Let me conclude indeed by once again addressing the importance of the report that you have prepared, the research, and even more by the creating a network of those institutions and organizations who took part in the research, which I believe is something that will stay for good and will remain, and is a very valuable part of your network. Thank you very much, and I'm also ready for some questions, if any.
Well, really thank you, Katarina, for your informative contribution, but also for your sense of dedication and passion towards children and towards this very important instrument that now the European Union has, the child guarantee. So now we have to go for some questions, and thank you for also sparing time, Katarina and Alioza, so that we can also, so I wasn't following questions, so I'm getting them from Agatha. Okay, so there is this question on the role of European Parliament and getting EU member states to implement support for early childhood, especially early intervention for children with disabilities. This question comes from Lydia Panko. So would like to start first on this.
Maybe
so how can we ensure civil society and children are engaged in the European Child Guarantee monitoring and implementation, and how the EC can support the member states?
Yes, thank you very much. I can start, and then maybe Alyosha or your colleagues would like to come in as well. You know very much that partnership principle is extremely important for us. We have clearly, it is written in the recommendation that it is very important to include the civil society, including and children as well, in the design of the national action plans. We have elaborated, first time when we met coordinators, we elaborated extensively on this partnership principle. And what we say is that it's not sufficient just to have them as the partners in the design. It's important to include the children, the civil society organizations in the implementation, but also in the monitoring and evaluation of the national action plan. So all the aspects have to be taken on board. This is something that we plan to highlight on every occasion, and we do it, all of us who are involved in the implementation of the child guarantee. We are also issuing I would not really say a guidance, because the policy is that no additional guidance should follow our documents, but we are issuing like support to the preparation to the national coordinators, the elaboration of the different articles of the recommendation. And there we have prepared almost like an extensive checklist what the member states should do in respect to really fulfill the partnership principle. And they are very much aware that in assessing the national plans, we are going to look into how they executed the partnership principle in the preparation, in the design, in the implementation, monitoring and evaluation, all the elements.
Well, thank you. Would you like to add something, Rosa, please?
So yeah, what I can add is actually that in the campaign with all 9 countries, and hopefully in future more coalitions and countries will join in our advocacy efforts. So it's actually, yeah, we will just continue our work so that the voices of not just children, but also families and the communities, the most vulnerable, should be taken into account. Civil society should participating in all the stages of creation, implementation, monitoring, design, etc. And yeah, we know that the European Union doesn't really have much space to force countries. It's more like in a place of suggesting, but I think that with joining efforts in advocacy around it, we can really, with the evidence, show at the country levels that this is something that should be prioritized and fulfilled. So just to add, yes. Thank you.
And another question comes up, and how can we bring more accountability into the system, Katarina? You've mentioned many a time, even in smaller meetings, that it's not just the action plans and the deadline in March, but the implementation, but also the evaluation of outcomes. So is this the accountability process, or is there something else planned to ensure that member states, national governments do implement the child guarantee?
Yes, Maria Luisa, you are absolutely right. It cannot be one of action, and it cannot stop with the preparation of the action plans. That is one of the reasons that we want to create this network of child guarantee coordinators, who is going to continue to meet regularly and report, more importantly, than meet the report on the state of play in the different member states. Also, we plan to continue to follow up the developments in the member states in the light of the European semester process, which means on the regular yearly basis. And I would not like very much to see recommendations and country-specific recommendations in this respect, but if needed, we are going to issue those. So these are, I would even dare to say, our regular tools how we monitor the developments in the member states. But here for the child guarantee, we will step up it really. We have the obligation of the regular evaluation in 2025, I believe, and then towards the 2030, 2029. But in the meantime, this is going to be, this is topic that is absolutely seen as the priority, not only at DG Ample and Commissioner Schmidt level, but also at the level of the whole Commission. And even more than just seeing some of the aspects that are traditionally, let's say, addressed by the social policy or by social policy ministries, we want to see involvement in all the others relevant for the child guarantee, the health aspect, the housing aspect, nutrition aspect, and then of course the ECEC and education that follow within the same basket most of the time. So it is really cross-sectoral approach, cross-sectoral exercise. What I see that is needed is really to empower coordinators. This is where I think our future actions needs to be step up even more and more. I also believe that you as the civil society should put a bit of pressure on within your member states on the coordinators in order really to support them, not to criticize, but really to support them and to empower them, because they are dealing with a wide range of stakeholders. And in order for the child guarantee to function, all of these different stakeholders have to be on board. And I always say what is more important is that they secure sufficient funding. So this is the key for the success of the child guarantee, that we have a sufficient funding at different levels, at national for the activities that national states are financing, and at local and regional level for access to those services. And we know that practically in all of our member states, the ECEC and education are at the level of local authorities or cities, and as well as the housing challenge. What I also would like to see, and what I fear a bit, if I can share it in this closed environment, is that member states might have a difficulties in defining who the children in need are, and that maybe some of the categories of children are not going to be sufficiently addressed. And this is also where I see all of us need to step up, promoting the as comprehensive as possible approach when it comes to defining who the children in need are. It's of course impossible that all the member states have the same problems, and that one size fits all is absolutely not applicable. But we must make sure that some of the groups of the children are not left out, and some of the services for groups of children are not left out.
I think this very last point is so very important and ties up with the need for participation of all relevant stakeholders, including civil society. Because I'm convinced, and I'm sure all of our colleagues are convinced, that civil society can really give a helping hand in identifying who the children in need are on the ground. And the fact that, I mean, yes, funds are needed for the implementation, and yes, civil society can help a great deal on a national level to empower, to even if possible, even if it is needed, to be watchdogs on this child. We need to make it happen. We cannot continue to ignore what is happening in front of all our eyes. However, even civil society need resources. I mean, it is not possible for civil society to put into action all that is needed to be put into action to ensure that we give the helping hand on a national level to ensure that what needs to be done is done. So I have another question here, and this is with regards to access to medical and psychological services for mothers and young children, example for Roma mothers. How are these provided in other countries? And this question comes from a child psychologist. So this is very important, I think. Would you take this, Alioza?
Yeah, I can touch upon this. So it is actually you can check the country profiles, the individual ones, to see what is out there in different countries, what was actually observed. But generally speaking, we know that, and yeah, when it comes to Roma, this is very dear topic to me because I myself coming from Roma community. So I know the situation from a different angle. And yeah, we are even within the initiative RAIN, within ISA, we are now running a research that will early next year bring up the evidence on the status of young Roma children in Europe. And this is also one aspect that we are exploring, and it will inform the advocacy efforts of the campaign. The access and the support that the mothers and young children are getting in different countries, European countries. And we have to say that we are quite sad when reading such results. You know, even just reflecting on the recent events, like when Roma communities were accused of being the spreaders of the coronavirus. So the entire communities were on lockdown, so nobody could enter, nobody could exit from the communities, from the villages. So it means they've been denied to access basic things. Not mentioning the support they needed. So it's and here the most crucial role plays the NGOs who are working with them. And this is something we will have to take a closer look in the near future and make sure that also such vulnerable groups such as Roma mothers and young families have access to the services they need and deserve.
Thank you, Katarina. Thank you, Alioza, for not just presenting very informative, constructive information to this webinar, but also for sparing time to take on board also some questions. So now I would like to pass the screen to Agatha from Eurochild, who will moderate the next part of the event. So Agatha, everything is in your hands now.
Thank you very much, Your Excellency, for giving me the floor, and thanks to the distinguished panelists and contributors of the first panel. That campaign that Eurochild and ISA are co-leading, the first year's first priority campaign, is really built to provide added value to national civil society efforts to advocate for early childhood development. And I'm really delighted to have in this second panel now the national coordinators from 4 of the 9 countries in which the first year's first priority campaign operates. I'm Agatha D'Addato, I'm Senior Program Manager at Eurochild, and I'm coordinating the campaign. I'm really like now to welcome Claudia Ponce de Leon Rodriguez, who works as a policy advisor at Plataforma de Infancia, which is a national coalition representing 74 child rights associations in Spain. I welcome Maria Herzog as well. She's the chair and program director of Family, Child, Youth Association in Hungary. I like also to introduce as one of the 4 panelists, Aurélia Rabé, Aurélia is Director of International Resources with Ensemble for Early Childhood Education in France. And then we have a colleague from Ireland, Siarsha. She's head of legal policy and public affairs with the Children's Rights Alliance, which unites 135 members. You are all very welcome to this second session of the day. Now, I'd like to invite each panelist to give, first of all, some key insights into the fundings from the analysis that was done some months ago on data on early childhood across the 6 policy areas that we looked at and that we heard from Aliosa a bit earlier. Claudia from Spain, can you share 1 or 2 key issues that you'd like to highlight from the fundings of your analysis in your country profile?
Yeah, hello, I hope you can hear me well.
Very well, Claudia, yes.
Okay, thank you. Thank you all for being here. And I know we are a little short of time, so I'll try to do as fast as I can. And as Aliosa said before, one of the key issues that we find that we have identified with analyzing the situation of early childhood in Spain is that there is a great lack of disaggregated data by age, but also by gender, by children with disabilities. So I think that has made it difficult to find certain indicators. And also in Spain, we analyze for national priorities that are child poverty. Spain has one of the highest rate of child poverty in Europe, and although there is some measures to help families and parenting support, they are not sufficient. The other national priority is early learning and also early care, and we need to make sure that all children have accessibility and have free access to these services. And also we need to make sure that we do work and life balance effective measure with a childhood perspective. And I'll go. Thank you.
Thank you, Claudia. And Maria, how does it look like in Hungary, your country?
Well, there are a lot of things I would love to share with you, but because of the limited time, I try to be very disciplined. So first of all, I would like to say that as we heard from Mr. Taquet, the French minister, and I was really delighted, early years start with birth and even with prenatal care. And it's important, should be also built into our thinking, because for instance, in Hungary, we still don't have family-friendly hospitals, and only 20% of the hospitals are baby-friendly. Most of the hospitals are still separating newborns from the mothers after birth, which means that we don't start early the support, and the Minister for Human Resources has just announced that they are not interested in any central guidance, and they are not following the WHO recommendations in this regard either, or neither. So that's a problem. Another issue that in Hungary, under the age of 3, children are attending creches or daycares only in a very small number. Still, it's about 16% of the children. And one reason behind that is the very long 3 years paid, although very badly paid, maternity leave or parental leave in Hungary. That leaves a lot of mothers in a limbo because they have no choice whether they want to work or not. There are no facilities available. But even more problematic is the very strong belief in Hungary that a child under the age of 3 should stay with the mother at home and not attending any form of daycare. Now, obviously, this is something we should tackle, as it is the same in Czechia, where it's 4 years actually. But obviously, compared to many countries like Belgium or France or the Netherlands, where it's 3-4 months, we should know much more about the background and the outcomes of these kind of provisions. Another issue quickly is that in Hungary, kindergarten is compulsory from the age 3. And in principle, the aim was to help children to catch up or not to be delayed, even those who are in a very disadvantageous situation. However, what we see that the circumstances or the environment is not provided. So many kindergartens are overcrowded. There are less and less kindergarten teachers available because of the very low remuneration and the low prestige of the job. And sadly, the government has introduced a new provision absolutely opposing any EU requirements on quality, that in the morning and afternoon, there is no need to employ highly trained kindergarten teachers. So anyone can take care like a babysitting activity in the kindergartens, which is a step back compared to the 150 years of excellent traditions of the kindergartens in Hungary. So this is also an issue. There is also another issue in regards to that, also mentioned earlier, that especially in remote areas and in small villages and poorer areas, there is a fast growing segregation going on. Roma children are segregated because the better off parents are taking their children to nearby cities or towns. So this is a barrier for the children to be integrated in an inclusive environment from early on. And then it is sadly continuing during the school years. Another issue, and that's my last comment, is that integration of children with disabilities or chronic disease hasn't happened at all. This is also an issue closely related to the lack of enough professionals, helpers, assistants in the kindergartens and creches. So that is leaving a lot of children out of the provisions. Thank you, Agatha.
Thanks to you, Maria. Aurelia from France, would you like to come to add from the perspective of the fundings of your country profile? And maybe you might want to highlight some synergy with what colleagues have just highlighted from their perspective, from their national context. Thank you, Aurelia.
Yes, sure. Thank you, Agatha. First, I would like to thank Minister Take also for his participation to this event. I think it's important to see also his commitment indeed for the first year's first priority campaign. And we need to recognize that there's been some further visibility which has been brought to early childhood development in France in the past years. That said, though, I think we need to be more ambitious in France and to achieve some more efforts that need to be made, in particular in two key issues. The first one would be about policies, strategies, and interventions that are still and too often implemented in silos. There are different stakeholders throughout different domains, sectoral domains, which are inconsistently involved in the different territories, not speaking also the same language. And that ultimately also leads to missing opportunities to reaching out and going towards all those children, especially those living in the most vulnerable situations. And I'm glad to hear from Minister Take also that indeed in France, we will have a universal proportionate approach, which addresses all needs, but more specifically those in particular needs. The second issue we would foresee in France, it's about considering also multi-dimensions of poverty and social exclusion. And that needs to be considered because there is, of course, the monetary poverty, the material and social deprivation, which are very important to consider because it addresses health, education, living conditions. And I'm thinking mostly about those families with young children in France living in social hotels without any possibility for children to really unleash their own potentials. But there are also two other dimensions that I'm thinking of, and that need to be really at the heart of the reflection. It's about all the what can be sometimes hidden. It's about social abuse, non-recognized contributions also from those families living in the periphery, institutional abuse, not really considering those who are really excluded. And I'm thinking, and we were talking about that, migrant background families, and all those different vulnerabilities that need to be addressed. we're not talking not all beyond children with special needs. We need to consider all types of vulnerability. We need to have a more accurate quality assessment also to really be put in the heart of the debate, at least in France.
Thank you indeed. Now, Siarsha, would you like to share the 1-2 key findings from the analysis in your country profile, and then maybe also reflect on some common opportunities or challenges that you see from the analysis of early childhood across the different countries?
Yes, and I think I'd probably echo a lot of what my colleagues have said. There are a lot of commonalities, particularly around the lack of data and disaggregated data for children under 6, but particularly under 3. And I suppose from the Irish country profile, what I'd like to highlight is really that need for a greater public investment in early childhood care and education. You know, we have some of the highest childcare costs in Europe. The European Commission have repeatedly called for greater investment, and linked to that is really the issue of child poverty and focusing targeted supports for early learning and care for children in need. And that in Ireland, that is particularly the children of lone parents, and very often there's an intersectionality with lone parents who also may have a disability in the household, who may come from a migrant background, who may be an ethnic minority like an Irish traveller. So, you know, there's a lot happening within that. And I suppose in terms of the kind of the things that I took from this morning's presentations in terms of where we have commonalities, where there are common opportunities, and where there may be common challenges. The challenges, I think, are right across the board. They're really lack of data, lack of disaggregated data to help us make evidence-based and informed decisions, the lack of investment and the lack of implementation, because where we do have strong policies, and Ireland is lucky that we do have first 5. If you look at the cross-country analysis, we're one of the few countries that have a dedicated early years strategy. Yet, you know, we are making some progress on it, but there's a lot more to be done. And implementation, I think, is a key challenge right across the 9 different countries. But then in terms of opportunities, and I know we might touch on it in a moment as well, I think the EU Child Guarantee and the EU strategy on children's rights is a real opportunity. And I'm really heartened and encouraged to hear about this drive by the European Commission to ensure that national coordinators are looking for that data at national level, that we are meant to support them to do that, that they will hear from children and young people. And that includes children in their very early years, and that can be done. We had a wonderful project in Ireland a number of years ago called If I Had a Magic Wand, and it dealt with the under 6s and what they would like to see their services look like. So I think these are some of the things that are a real opportunity, and we can all really add to those. And I think this is very timely in terms of the launch or this public piece around and discussion around the First Year's First Priority campaign, because I think that can really lend a hand to the national coordinators in developing their national action plans on child poverty at national level.
And talking indeed about the design and development of the National Action Plan for the Child Guarantee, Aurelia, how do you think that these EU milestones and great frameworks can help making progress on early childhood at national level, especially for the most vulnerable children and families?
Yes, this is an important momentum in Europe that really gives the opportunity to address inequalities from the very early years and to put into perspective early childhood. I think that those 2 key milestones will be really important to take steps also to bring together knowledge from multiple fields and use it to change the national conversation, at least in France, about the early childhood years, speaking about the signs of child development. speaking all the scientific base, we were talking about data oriented, but being also science oriented, and speaking the same language, and to overcome prevailing misconceptions about child development will be also essential to spread out, not only with, I would say, experts, but all across the society, including policymakers.
May I just say, sorry.
Yeah, go ahead, Maria.
No, I just wanted to say that backing up everything what you have just said, I would like to raise an issue in connection with all that, which would be the first one, that a kind of transparency in preparing all these programs, because in some countries we don't even know who the coordinators are, what are the plans of the government. And so we would like to encourage the EU to oblige the countries to make all these procedures transparent and open for all, because otherwise we cannot contribute. And obviously the civil society, those parents and children who should be part of the discussion are not involved. Even the stakeholders oftentimes have, they lack information or proper information. So I guess this would be the first and most important requirement, that we see who is doing what. And another issue I would like to raise here, that for instance in Hungary, and I'm sure that it is the same in many other countries, there are a lot of current programs ongoing with EU funding without knowing about each other and without informing the public. So there should be a kind of website or a list of all the ongoing projects in the different topics, so that everyone can follow what is going on in a different country, and the synergies should be utilized, because oftentimes these are happening in silos, not oftentimes even targeting the same groups of families or children, without working together and without informing all of us, so that we could contribute and help strengthening the procedure. So I guess this is something that should be considered now when the Child Guarantee Program is just starting. And I don't think that this is a very complicated, I mean, technically complicated procedure to gather all the ongoing projects and make them available for all.
Absolutely. And Claudia, from your perspective, would you like to add any reflection on how can EU initiatives, including the Child Guarantee, support tackling poverty and social exclusion in early childhood and drive national progress in relation particularly to families and children from vulnerable groups?
Yeah, I will talk about the special case in Spain. I don't know if you know, but there is a large delegation of competencies to the autonomous communities in Spain. So the approval of the EU Child Guarantee is a major milestone to put early childhood in the center of the national policies. And also, I think it's really important because it's going to be the key to join forces between the administration and for the achieve to this goal. So I think it's it's the start of a common activity to achieve this goal in Spain.
Thank you. And then before closing this first round of reflections, I'd like to invite Siarsha to reflect maybe on how the fundings coming from our analysis can inform policy responses on early childhood development. If there are any solutions that might come into mind.
I think I think the really valuable part of this project has been really that peer learning piece, and that we've all kind of seen what works and what doesn't right across the board and shared that. And I think that going forward will really help to strengthen responses at a national level. And I think, having the EU Child Guarantee there, with member states having to report back on that, that will really help us kind of push this forward, because, for example, in Ireland, we have a number of opportunities now in terms of investment on early childhood care and education. We have a citizens' assembly who's recommended moving towards a publicly funded model. There's a report due on a publicly funded model. The government has committed to set up a childcare an oversight body, Childcare Ireland. And we can really kind of look at what's worked in other countries and what hasn't, and kind of bring that to the fore, I think. And we have the evidence and the information now from other countries to demonstrate that. And I think the other really valuable piece around this project and this campaign has been that we've done the mapping exercise for our governments. We've looked at where the gaps are in data, and we've kind of demonstrated why you would need to fill those gaps and why it's important to do so. So we've done a lot of work for them, and I'm hoping that they'll see it as a supportive way going forward, and that they'll actually engage with all of us on that to try and address those gaps and provide real life solutions that work in practice.
Thank you very much for sharing your valuable insights and reflections, each from the perspective of your national context. Before opening up the discussion with the audience, and by the way, feel free to pose your questions to any of the colleagues via the Q&A section function of Zoom. But now it's my pleasure to welcome Marta Tarragona Fenosa from the European Commission, Coordinator for the Rights of the Child team in DG Justice and Consumers. Marta, I'd like to invite you to react to what you've heard, but also to give your perspective on the role of the EU strategy on the rights of the child in upholding children's rights in early childhood and catalyze support at national level. What are the opportunities? What are the barriers? Marta, you have the floor.
Thank you, Agatha, and good afternoon, everybody. Just a small thing, I'm not the coordinator, I'm part of the team, just for everybody to know. So thanks very much for the invitation, and congratulations on this campaign and on putting the spotlight on this group of children on the first years of life of children. I've been asked to provide some policy responses. What have we thought at EU level to reply to some more the challenges you have highlighted in the report that you have produced. I've prepared a PowerPoint presentation which I will share with you. I hope you see it. And I will put it in presentation mode if I can move the 1 second. Now it should work. Yeah, perfect, thank you.
Yes.
So yeah, as I was saying, I will provide you an overview of what are the actions that we have put forward in the EU strategy on the rights of the child. For those of you who don't know it yet, on the 24th of March of this year, the European Commission adopted the EU strategy on the rights of the child. This is a framework, a policy framework that puts together legislative policy actions, but also funding opportunities for the promotion and protection on the rights of the child on the EU. I'll go more into details on specific themes of the strategy and particular actions. I would like to highlight that we took an approach where specific needs of groups of children were considered. For this specific campaign, it's essential to refer to the group of children on different ages. So we put the spotlight on in certain actions and narrative in the strategy, as you can see, into early childhood, or also to adolescence, for example, and differences that children can encounter on grounds of gender, disabilities, migration, LGBTIQ, or ethnic backgrounds such as Roma, among others. It's important to recall that the EU strategy on the rights of the child, it's a policy document, but it's not a starting point on the EU action on children's rights. The work has been going for a long time, and this has been shown in the several legal and policy instruments that were produced in the passed and that they're currently in place, and that can be found in this Annex 2 on the EU strategy on the rights of the child. They're the legal and policy frameworks that relate more particularly on children's rights, and I will highlight some that I think can be useful for your work and your advocacy. In particular, I think it's important, given the groups of children that you have particularly analyzed in your research, to remember that the EU strategy on the rights of the child needs to be read together with other strategies, other equality strategies that have been also adopted in the last 1-2 years in the European Commission. I'm referring to the Roma strategic framework, for example, migrant integration, disability, or gender equality strategy. You will see in this strategy, we have put forward actions for the European Commission, but also recommendations for EU member states. So the thematic areas of the strategy are 7, but we'll focus particularly on 4, which are more relevant to the area of work of this campaign. So probably the most relevant to your initiative, the thematic area on social inclusion of children, which covers 3 particular subtopics. The first one is the broad one on child poverty and ensuring equal opportunities. And here, the key action and the landmark, one of the landmark actions of the EU strategy on the rights of the child is precisely the European Child Guarantee that the director Katarina from Disney Employment has been discussing previously. Other instruments, legal and policy instruments that are relevant for the early years of children are, for example, all other anti-poverty policy frameworks that exist since several years. I'm referring to the European Pillar of Social Rights or the 2013 recommendation on investing in children. I was referring to the many legal instruments that we had at EU level, and I wanted to highlight and respect the work-life balance directive. In several months, the member states will need to have implemented international legislation this directive, which we need to recall that it has and sets specific rights for parental leave, for example, or on setting flexible working arrangements for parents or carers who have children below the age of 8 years old. I wanted to also recall that the EU is also supporting children in these first years in their life through funding. Katarina had mentioned the European Social Fund, but also the European Regional Development Funds. These are just some of the funds available, but of course the EU has many more. On healthcare, you'll see that the strategy focuses on specific topics, although the action, of course, is broader. I wanted to highlight here the vaccination council recommendation and also actions on mental health. On education, and this has been mentioned already, we have the Early Childhood Education and Care Quality Framework that was adopted a couple of years ago, and where work has been really developing in this area. One of the key actions we have in the strategy in this respect is that the Barcelona targets, which set what are the targets at EU level on early childhood education and care, will be revised. To remember that there are 2 targets, one for 0 to 3 and another from 3 until the school age. As for recommendations for member states, I pointed out here the action plan on integration and inclusion for migrant children. A couple of more areas where we have actions that are relevant for your initiative is the one on combating violence against children and child protection. On this one, one of the key actions that the Commission will put forward is an initiative on integrated child protection systems. And the idea is here is to to launch an initiative in the future where we will put standards on how different authorities and professionals at national level should work together and having the child at the center in a coordinated and cooperative manner in cases of violence against children. The Commission will put forward also a legislative proposal on gender-based violence in the next months. On recommendations for member states, it was mentioned that the care, and here it's because of the competence at EU and national level, so it's more a national competence. We put forward an action promoting national strategies and programs to speed up the institutionalization and transition towards quality family and community-based care services. As security and protection has been highlighted in your report and the initiative, I highlighted here that we have important legal instruments on, for example, child sexual abuse. In relation to child-friendly justice, I noticed the focus, of course, on children with migrant backgrounds. So here we have also funding available and at EU level, and in relation to children who are stateless. In relation to this, we put forward our recommendations for member states on promoting and ensuring the birth and registration. And I'm coming to the last chapter of this strategy, which we call it the mainstreaming chapter. It's because the actions that we put forward in this chapter, they are more global, they are horizontal. Most of the actions are for the institutions, for the EU institutions itself, on how can we improve the promotion and protection on the rights of the child. How does it link to your report? One of the actions that we put forward is that we need to pursue more data on children. And we need to also invest more on research on children. As Katarina was mentioning, there are important funds and that can be used for the promotion and protection of children's rights. I'm referring to EU funds and programs, but also it's important, and we recall member states that they also need to put their funding available to this end. One important element that I wanted to highlight is how we all need to work together on this particular field of the promotion and protection of children's rights. So on the dialogues we have with member states, we have currently an expert group on the rights of the child that will be upgraded to a new network for children's rights. The idea is that we keep this dialogue with member states and we undertake additional activities. We want to link it better and improve the cooperation also with international organizations as well as civil society organizations. I highlighted here the civil society organization role, your role, which is key for the EU in the promotion and protection on the rights of the child. I think the role you're undertaking, like with this research, like really getting as the results can be really beneficial, so that we can effectively implement policies to this group of children. On coordination of national at EU level, we have the coordination of the rights of the child team, where we undertake this dialogue inside the institution and ensure that the information is transferred. And last but not least, and because I noticed, and it has been mentioned several times the importance of the coordination. In the report, I know it's more a matter of a coordination in respect to the early years. So specific services are key to be involved. In the strategy, we call for a coordination at national level that of course needs to include this coordination also for these early years. So in the strategy, we call for member states to develop, if they don't have done so, national strategies on the rights of the child. So with this, I would finish my presentation on what are the policies in place, the legal frameworks in place, and the funding opportunities that are available. I think it can be for civil society organizations a good opportunity to push with member states and to work together with member states and the EU institutions, children, families, etc., on how these first years of a child can be the best possible. So thank you, and I'm looking forward for the discussion.
Thank you very much, Marta. And sorry, there were two blocks, black blocks on the screen on your slides. So
okay.
Sometimes it was difficult to read, but we could very well follow your narrative. So thank you very much. And also to offer your perspective on the EU strategy on the rights of the child, complementing very well and very nicely the perspective on the child guarantee offered by Katarina earlier today. So I've got one question for panelists and whoever wants to reply and pick it up. What can help to monitor success? How do we evaluate that programs are working or are not working? How can we ensure that the communities, families, and children that are involved in or are beneficiaries of early childhood services are actively engaged and are actively helping to evaluate those services? So I invite whoever wants to pick this up to come back.
Well, actually, if I may just come first, there are many indicators that we have developed already and will be further developing, I guess. We've learned a lot about evaluation, I guess, also, but at the same time, I also have to express my concern if we are not working together on a more unified way of monitoring and evaluation, and do not learn from the past experiences in this regard, because oftentimes these indicators are not describing the full picture and quite tokenistic. So if we are serious about the outcome measurement in child guarantee or anything else, then we should utilize all the experiences we've got. But also, as we were talking about it previously, we should ensure an independent monitoring and measurement system, including all the stakeholders. So it's not only the government and those partners who are kind to them to do the monitoring and the outcome measurement. So that's how I see it. It's not an easy task. We haven't succeeded much so far. And obviously we are very disappointed in many instances, but we know the lessons. So we know how to do it if they let us do it.
Please.
I'll come in there, Agatha, if you don't mind.
Yes, please. Yeah, sure. Yes.
I completely agree with what Maria said there. And I think it's really important that when we're looking at any programs and whether or not they're going to be successful is to identify from the outset what the measures of success are, so that we have a baseline that we can measure against. I think that that's one of the hardest things that we have to do. But as Maria said, we've learned a lot from this. We have a lot of data, so I think that can be done. I think as well, building in monitoring and evaluation from the very outset is crucial if you really want to measure success. And having beneficiaries and communities, families and children involved, they need to be involved in the design of programs as well as just the, talking about what the outcomes are and what the impact has been on them. I think if this is truly to impact on them in a beneficial way, then we need to include them from the outset and hear what isn't working at the moment and design programs and responses that deal with those problems and try and fill those gaps. So I think those are some of the ways that we can do it, and we can learn from each other. I think, again, we've learned a lot from what works in one country and what doesn't, and we all have very different national contexts and different levels of investment, different policies and strategies in place, but we can learn from those. And I think one of the things that was said by one of the participants earlier was having a common language. And I think the EU Child Guarantee helps us to do that, helps us to have a common language and have common goals and ambitions that still resonate in the national context.
Please, Aurelia.
Yes, I do agree with my colleagues here. One aspect that we would like to emphasize is also to enable also the measurement of quality, also the quality of the measures, because and it somehow relates also to an impactful child guarantee, a reality, yes, but also an impactful child guarantee in the field to really benefit the families and the young children within the most vulnerable situation. So quality is very essential to consider, not only about figures, and talking also about figures, and it comes back to our earlier discussion on data-driven, because this is really an emergency that needs to be addressed right up front, of the first report that will be released. And another point I would like to add is about child participation, of course, but indeed, but not to forget those in the most vulnerable situations. I'm thinking about children currently living in social hotels here in France, to consider the voices of those children, but also of their parents.
Yeah, thank you. I've got another question. So maybe Claudia or Marta, you want to reflect on this. There will be always vulnerable families and children that fall through national policies and do not make use of local services. How do we improve access to these families and children? So it's really from the perspective of the most vulnerable and reaching them up. Marta, have you got?
Yeah, thank you.
Any reflections on this?
Yeah, thanks for the question. Yeah, indeed, that's one of the challenges, like going from top, from the EU to national to local and to families. Like how can the also the families reach to the local level? So how can we the policies at local level, how can also be up to some policies at the EU level, like the child guarantee. I know, for example, the universities developed a report a couple of months ago on how the local policies can help in vulnerable families, in particular in relation to the European Child Guarantee. So that can also be a collection of good practices that can be useful.
Yeah, Siarsha, and then we move on, please.
Yeah, just one quick point on that. I think it's really important to think about that local level. And one of the things that we'll be doing in Ireland is talking to our national coordinator about the National Action Plan, but encouraging interagency groups at local level to put at county level to put in place local child poverty action plans that link to the national, because I think that's really important. And we do have Children and Young People Services Committee at local level that bring together the different agencies in Ireland, and I think they're a crucial part of this and need to be factored into that, partnership principle piece as well. how you link both of those. And I think unless you do that, it's not going to trickle down or have that trickle down effect that we needed to do to really address child poverty and ensure that those people who always fall through the cracks don't continue to fall through the cracks.
Yeah, I guess just backing up what was said already, I would add that actually utilizing the intersectorial, multi-sectorial cooperation would be very helpful, because obviously those hard to reach families are meeting certain services, primarily health services. So if not other ways, then we could approach them and find them through the general practitioners, pediatricians, health visitors, and then involving them in other activities. In Hungary, for instance, we have implemented the Sure Start program for the UK, aiming at reaching out the most vulnerable children in the communities. And this, together with other organized programs like play groups or toy libraries, that would help to include the families and encourage them to attend with the children, and then obviously involving them in other activities. Again, the compulsory kindergarten that I was mentioning could be a good tool if it were supportive to the families and children. Because currently, what is happening in Hungary, for instance, that if children don't attend regularly kindergarten, then family allowance can be taken away and even children can be placed out of the family. This is not the way we should reach out families, actually the opposite. So we should be supportive and integrating and inclusive and not punitive, because then obviously we can't reach those who we want to help and whose participation would be so essential. Thank you.
Sorry, Agatha, just linking with what Maria said. I think it's very, very, very important to give more specialization of professional that work with these families and with the children. I think it's essential for these to get better, because otherwise they don't know how to act, how to treat them, how to tell them how to do things, and I think this is very important. Sorry.
Thank you very much to each and every one of you. Obviously, in Europe, some countries are farther ahead than others in terms of policy, services, and frameworks promoting early childhood. That's the beauty, if you like, of this First Year's First Priority campaign. Being cross borders and cross countries, we can learn for one another. And this is what we try to achieve through our campaign, scaling up what works, identifying gaps, and influencing national budgets in the long term. Thanks to panelists and participants for contributing to this second session discussion. And I'd like now to give the floor to Liana Gent. She's Executive Director at ISA, the International Step-by-Step Association, co-leaders of the First Year's First Priority campaign. And Liana will provide the concluding remarks. The floor is yours, Liana.
Thank you very much, Agata, and a warm thank you to all our partners, all the participants. So much has been shared, and it has been really inspiring to see how aligned we are, both in terms of identifying the challenges, but also in terms of seeing the way forward. And many of the speakers reflected that sadly, we now know our reports and our data already show that too many children already live in poverty or are at risk of poverty in Europe. And this is a challenge that cuts across all countries, whether they are richer or poorer, as a comment in the questions was made. We also can see that the child guarantee and the social rights pillar are the way forward to tackle exclusion and to make all children have access to equal opportunities. But to make the child guarantee a reality and to improve access and quality of services for young children, there is a lot that is needed. And just to summarize from what was said, to highlight some of the key points, of course, data, the need for data that was redlined through all presentations, but also funds are needed at the European level, but also at country level and at municipal level, at central level, where these services are actually offered. I would also like to highlight the role of civil society, and I was very happy to hear this emphasized throughout the event today. The civil society can play an important role and has already played in terms of highlighting the challenges, the gaps, but also with successful pilot projects that can be then scaled up after proper research on their impact, and also the role of the civil society as a watchdog. And finally, we need to see early childhood development from a holistic perspective. In other words, not only to focus on early childhood and education, early childhood education and care services, but also on other types of provision and support for families and young children. And we need to start early, prenatal. This is an utmost key message from our campaign. It has also been shared many times what a wonderful opportunity we have now as part of this campaign to learn from each other, to learn among countries, and also that the time for action is now. We have these opportunities, we now have the information, we have partnerships already that have been forged, and it's up to all of us to be strong agents on behalf of young children. In the last few seconds of our event today, so we can end on time, on behalf of Eurochild and ISA, who are the co-leaders of this campaign, a warm thank you to all our partners, the IFA, REF, but also the national coordinators and their teams, and a very warm thank you to our supporters who have made this, our funders who have made the campaign possible. A warm thank you also to all presenters of today. What a rich sharing we've had. We're very grateful. And to all participants, many of you staying with us throughout the end. What's next? As you see, there's so much we all need to do, and we all can play a role in this campaign. So we invite you to join us, join forces with us in the campaign, whether you are active at the national level or at the European level. And also we invite you to read and use the data we have produced so far, to follow us on social media and engage with us, sign up to the newsletter. We have, as was mentioned, have worked so far in 9 countries, as well as at European level. And as a next step, we hope to add more countries to the campaign. We also hope to strengthen all of our capacity for advocacy and for being successful agents on behalf of young children. So again, a pleasure to be here with all of you, a pleasure to be in this wonderful partnership and to work together in the future. Thank you for joining us today.